My name's Dr. Manrina Rhode and I'm the aesthetic dentistry expert for dentistry.co.uk. Today we're going to be talking about gummy smiles. So often patients come in with gummy smiles and there's so many different options available of how to treat them and also choosing which option's the right one. So let's go through all of them and talk a little bit about diagnosis and your treatment options. So firstly, there's gummy smile Botox. It's small amounts of Botox that are placed on either side of the nose that stop the elevator muscles that lift the lip on smiling. So when you're talking, when your mouth is at rest, there's no change to your lip movement, but when you smile, the lip doesn't smile quite as much. Now, with a maximum dose of gummy smile Botox, you get about a 3mm reduction of lip elevation. So when someone comes to you with a really gummy smile, you kind of need to have a look at how much you want to reduce the smile for them. What's not aesthetic is to reduce that gummy smile too much, and then they end up with a sort of a really weird fake smile where they can't lift their upper lip appropriately. So that's a consideration there. The other thing, I guess, with gummy smile Botox is it's not a long-term solution, other than if they want to come and see you every 3 or 4 months for the rest of their life to manage that gummy smile. So some patients don't mind that, and maybe if they're older, that's not such an issue. But if you're starting quite young in life, then you'd want to look at other solutions. Now, what's the reason for the gummy smile? Is it due to a skeletal discrepancy? Is it because they have an elongated maxilla, and perhaps you want to think about surgical options to reduce that? Is it because they have a decreased crown length of their tooth size? And actually, quite often in those patients where they have gum overgrown over the tooth, when you remove gingiva from the tooth, it gives them their correct tooth proportions back. There's usually healthy enamel underneath the gum, so you unveil a beautiful tooth underneath, and also you reduce that unaesthetic gummy smile. So it's a win-win-win solution for a lot of patients. To know how to treatment plan that, you need to know what the ideal length and width size of the central incisor should be. So an average length of an ideal central incisor, upper central incisor, is 11mm long. So you take your ruler, measure from the gingival zenith. The gingival zenith is the highest point on the gum margin to the incisal edge of the tooth, and see how much enamel is visible. If you only have, for example, 9mm, then you know by elongating the tooth by about 2mm, you'll get a much better tooth proportion. Also, central incisors should be longer than they are wide, in a 1 to 0.8 ratio. So have a look at the width of the tooth and see how that will get the tooth closer to ideal proportions. It's really worth spending some time learning about the rules behind smile design. It's not something that we're taught at dental school, but it really puts us in good stead moving forward and understanding patient smiles. The proportions and the measurements that are taught to us during smile design have been created over years, looking at thousands of perfect smiles and seeing what is it about them that makes them so attractive. So actually, by following those smile design rules, it would be highly unlikely that you wouldn't create an aesthetic or a more aesthetic smile. So they're worth spending some time getting to know. When you're going to lengthen a tooth to minimize a gummy smile, so if you're going to remove gingiva to unveil tooth tissue, then you also want to have a look at the incisal edge of the tooth, just FYI, because if their gingiva is overgrown, it may be because they have an anterior grinding habit and they've worn away their enamel there. So as a dentist doing full mouth dentistry, it's something else to keep an eye on and have a look at that. That's part of your treatment plan. Also, the frenum attachment can play its part in your gummy smile. So if you have a laser, an electrosurge, it can be done with a scalpel. In gummy smile patients who have a low attachment, there can be some benefit in just removing that frenum attachment, so that when they're smiling, the lip doesn't lift quite as much. The frenum has a tendency to regrow, so you need to give your patient exercises puffing out their mouth a couple of times a day for about 7 to 10 days after you remove the attachment, so that it doesn't come back, and that gives you some more long-term results in the cases where you've got a lower frenum attachment. So there'd be some benefit there. So that's a whole bunch of different suggestions for gummy smile treatments. I hope you're looking out for your patients' gummy smiles and talking to them about them, and maybe giving you some food for thought about how to help them treat them.